Danish pharmaceutical company Novo Nordisk recently dethroned luxury goods maker LVMH to become the most valuable company in Europe after it launched its smash hit weight loss drug Wegovy in the UK. In fact, this century-old company with a market cap of over $425 billion has seen its stock gain 3x in just the past 5 years and 70% in the past 1 year, mainly due to its blockbuster diabetes and weight loss portfolio of drugs, Ozempic, Rybellis, and Wegovy. All three of these drugs contain the common active ingredient semaglutide. Initially prescribed for type 2 diabetes, these drugs soon became money spinners because they also aided in weight loss. From Ozempic being mentioned at the Oscars to celebrities such as Elon Musk, Amy Schumer using it, to the drug being in shortage due to the high demand. Ozempic, for example, launched in 2018 for type 2 diabetes and administered as an injection once a week, generated sales of $8.56 billion last year. Wegovy, launched in the US in 2021, is the same as Ozempic but prescribed specifically for weight-related conditions, crossed $1 billion of sales in just 1 quarter. These weight loss drugs are expected to rake in over $15 billion of sales for the company this year alone. And it's not just semaglutide-based drugs. Eli Lilly's type 2 diabetes and weight loss drug, branded as Mounjaro, which was approved in May 2022 in the US and has seen sales jump 60x in just 1 year. So what is the hype behind these weight loss drugs? How do they work? And are they safe? These drugs basically mimic a hormone in the body, GLP-1, which is naturally present or produced in the body. When you eat, the GLP-1 hormone signals the pancreas to release insulin. Insulin helps in lowering blood sugar levels by enabling cells to take in sugar from the bloodstream. GLP-1 also slows down the rate at which food leaves the stomach, making you feel fuller for longer. By mimicking GLP-1, these drugs help to control blood sugar levels in a similar way by stimulating insulin release and slowing down digestion. The slowed digestion and feeling of fullness can also contribute to weight loss, which is beneficial for managing type 2 diabetes. And yes, these drugs have shown results. Adults using semaglutide drugs, the one which Novo Nordisk sells, have lost as much as 15.9 kgs or 15% of their body weight over 15 months. Adults using Eli Lilly's drug have lost up to 16% of their body weight. So how safe are these drugs? Side effects of these drugs include nausea, diarrhea, vomiting, and constipation. In the long term, studies show patients are at a higher risk of conditions such as pancreatitis. Doctors say the benefits might, however, outweigh the risks of these drugs, as they are expected to reduce the risk of strokes, heart attacks, or even death in those who have type 2 diabetes or suffer from obesity. But the fear is misuse of these drugs for cosmetic weight loss purposes. One of the key issues, for example, is the psychological impact of these drugs. Experts point out issues such as addiction to the weight loss, hence misuse of these drugs, and not to mention issues such as the psychological toll of regaining the lost pounds once they stop taking the drug.